Our first speaker for today is Dr. Erin. We know how important it is to take care of our health, both mentally and physically, especially now with the way that COVID has affected so many of us. We felt that it would be beneficial to our attendees to hear from a registered health professional. Dr. Erin is a naturopathic doctor with an extensive background in clinical research. She holds an undergraduate degree in physiology and a master's of science in human health and nutrition. Dr. Erin has lectured to audiences on healthy weight management, evidence-based nutrition, thyroid health, anxiety and depression, acne, and managing cancer side effects. So she is sure to provide us with some valuable knowledge today. At the end of Erin's presentation, she will be raffling off a $50 e-gift card to one of our registered attendees. Take it away, Erin.
Good morning, everyone.
How's it going?
Good. How are
Good.
you?
Good morning, Erin.
Good morning. So I'll just go to share my screen now. Good. So welcome, everyone. So today's conversation is all about women's mental health. And I've been involved in women's health and women's health advocacy for ever since the beginning of my practice. And I've become even more involved in it since, especially since COVID. We've been absolutely obsessed with ensuring that women are feeling as supported as possible during this time. So this conversation is going to be about what's been missing in your assessment and the treatment of your mental health. So that's what we'll be chatting about today. So let's start with a universal truth, and that is that anti-anxiety and antidepressant medications are not bad. I see this all the time that people are really nervous to come see a naturopath because there's this fear that I'm going to encourage them to come off of their medication, that there would be shame surrounding patients' decision to medicate. And I want to make it very clear that I want the best for my patients, whether it's quote unquote natural or not. I've referred patients back to their family doctors for prescriptions for antidepressants, for anti-diabetes drugs, for blood pressure medications, etc. Why? Because it was the best decision for that patient. I don't think medications are bad. Sometimes they're the best option. So call me a revolutionary, but I think you deserve the best, whether it's quote unquote natural or not. So why are you here? Maybe you're here because you're overwhelmed. Maybe you've tried a whole bunch of stuff to support your mental health and you're overwhelmed by what you've tried and what you're yet to try. Maybe you're confused, right? There's so much information out there. You're unsure of what's good quality information. There's too many supplements, pills, diets, exercise routines. You don't know what the best fit is for you. Maybe you're a little fed up. Maybe you've tried the supplements. Maybe you've been on and off different mood medications and you haven't seen a complete resolution in your symptoms. And also, you're probably here because you recognize the importance of your mental health in the overall health of your body. And this is just a quick disclaimer that everything in here is just informational based, that we do not have a doctor-patient relationship set up. So just take everything in this presentation purely as information. So we're going to go through our topics through the lens of one of my patients, and we'll name her RB. RB is a 29-year-old menstruating female who came to see me with an already established diagnosis of bipolar disorder type 2. So bipolar disorder type 2 is this mood cycling between highs and lows over time. But unlike bipolar type 1, the up moods don't quite reach mania, right? So RB was prescribed mood stabilizers and antidepressants, but she came to me feeling these non-significant improvements in her quality of life while she was on these medications. And her experience was incredibly distressing for her overall function at work, with family, with personal relationships. So that's why she came to see me. So we'll check back in with RB at the end of the presentation. So I'm Dr. Erin. As was already talked about, I do have an extensive background knowledge. In my master's program, I focused on human health and nutritional sciences. And with my critical appraisal skills I developed during my master's degree, I realized that there's a lot of crap information out there, even in scientific literature. So one of my superpowers, as I call it, or one of my skills is to read and sift through scientific literature, get rid of the crap, and be able to present the knowledge to patients that they can make the best decision possible for their health, right? And then finally, through my years of clinical practice, I've consistently seen people with mood and mental health disorders. It's a group of conditions that are often brushed aside and perhaps met with a great deal of stigma. And I'm recognizing more and more as I move through my own personal life that many of us struggle with mood, mental health, and for me personally, recognizing the connection between, we're going to talk about periods today, the connection between PMS and mood as well. And I want to treat mental health from all angles, right? And I want to help patients understand their physiology and their mood. And I have a dog, which you might be able to see her on my beautiful black sweater, her white hair. So this polling question, which I don't know if we have answers to this, but is if anyone's worked with a naturopathic doctor before, and knowing that that is absolutely an option. Let's see here. So absolutely recognizing that that is a treatment option that you can go through, an avenue that you can explore is working with a naturopathic doctor. So where are we going today? Where are we going today? We are going to be talking about your period and your mood. We're going to be talking about menopause and your mood. We're going to talk about blood work that might need to be explored, and then also nutrition/lifestyle interventions. So remember, the goal of today's seminar is we'll be discussing less familiar causes and unexplored avenues to your mental health. We'll talk about tangible intervention strategies that you can start right now, that can help with your resiliency, your ability to tolerate stress, and your mood. So this is your menstrual cycle. Menstrual bleeds are called periods because they are supposed to arrive periodically in a monthly pattern. So to qualify for PMS, the symptoms must occur after you ovulate, which you can see kind of right in the middle of the screen. That's ovulation. And those symptoms need to clear shortly after your period or your bleed starts. And what causes PMS? So estrogen and progesterone are good hormones. They aren't evil, they aren't to blame. They actually have very positive effects on your mood. However, at the end of your menstrual cycle, as long as you aren't pregnant, your hormones have to drop. They have to decrease. And as estrogen drops at the end of your cycle, serotonin and dopamine drop too. And that withdrawal from estrogen can cause fatigue, night sweats, migraines, and the same with progesterone. If your progesterone drops too quickly before your period, you might experience symptoms of anxiety. So, learning about your period and your mood is so crucial. But know that I just have to throw this out here for the feminist nature in myself. The term PMS is subject to misuse as well. Too often it's used to trivialize women's emotions. Yes or yes, right? As a human being, not just as a woman, you have the right to experience emotions, and know that we have been conditioned to a male 24-hour workplace rhythm, right? But as menstruating women, we operate on a 28-day cycle, not a 24-hour cycle. We have shifts and changes in our moods and our energy levels, and it's okay to notice those shifts and changes. But what's not okay is when your anxiety and your depression that come up in your PMS window interrupt your daily life and your functionality, right? That's the problem. So 80% of women report some sort of physical and emotional changes in the second half of their cycle. And then 20% of women experience severe enough symptoms to actually seek medical help. So when we think about mood-based symptoms for PMS, people often think like it's just like, I'm a little less patient, maybe I'm a little irritable, but mood-based symptoms can run the gamut, right? Being anxious, tense, lack of energy, feeling overwhelmed, trouble getting or staying asleep, trouble concentrating, having more conflicts with people. These are things that I want you to start to pay attention to, right? So, your homework, and this is part assessment to see if you have PMS based mood symptoms, and also the treatment. And I'll explain that more in a second. What you're going to do is you're going to track your cycle. So download a period tracking app like Flow or Clue, input the days of your period in the app, but then also make note of physical and mental emotional symptoms in that app as well. So if one day you wake up and you're feeling just like kind of sad and you have no idea why, put that in your app. Maybe one day you wake up and you have so much confidence. You're like, where the hell did that come from? Put it in the app. And you may start to see that some of these mood based symptoms line up with certain parts of your menstrual cycle. And we know based on literature that when we teach women about what PMS is, how their menstrual cycle works, their PMS symptoms actually get better. So just by understanding your cycle, you will feel better. So this here is actually treatment and also assessment. And I'm not sure how this polling thing was working. Things are popping. Oh, here we go. Yes, things are popping up on here. So do you track your menstrual cycle? We have 53% saying yes, 37% saying no, and 10% saying sometimes. So sometimes I forget. So I would love to see everyone, as long as you're a menstruating woman. If you're in menopause, no need anymore. But if you're still getting a period, I'd love to see everyone tracking their cycle. So important. So this is a big one, perimenopause and depression. So women in perimenopause continue to have a menstrual cycle, although it can be irregular. So that often confuses whether the symptoms that they're feeling are hormonal or from something else, right? And the time before menopause, so when you've been away from your period for a year, that's considered menopause. Perimenopause can begin 8 years before your last period. So it's a significant chunk of women's lives spent in the perimenopause period. So women who struggle during perimenopause often have struggled earlier in their life when hormones fluctuate. So PMS and then also postpartum. Women who get tested during perimenopause, like their blood tests, are often told that their hormones are completely normal, which is true. The crude number of a hormone on a blood test has no bearing on how a woman actually feels. So that's why perimenopause is so difficult to assess and then also treat. A woman's mood and hormones are tightly connected with both low estrogen and low progesterone. playing an important role in mood regulation. Low estrogen levels, which can occur, as we said, in your PMS window, but also during perimenopause, can trigger depression through the hormone's connection to serotonin. That's kind of the mechanism behind it. Um, so it's important to recognize that it is absolutely possible to experience almost like a sudden shift in your mood. And we're going to talk about being over 42. So some women in my practice, they came to me when they're 43, 44, and they're like, I don't know where this came out of, like where the hell that came from, but my mood has been crap for the last year. And I don't know why. Like there's been no change in my life circumstance, no experience of grief. It's just like all of a sudden I turned 41, 42, and there goes my mood. So women over 42 need special attention when they approach their practitioner regarding their mood symptoms, and they need to share a detailed report of their PMS and perhaps even postpartum depression experiences in her life. This should be taken into account, perhaps even before medications are prescribed, because there's solutions that don't include antidepressant therapy that may fully acknowledge the health changes that occur in the last 8 years before the final period. Without supporting women to understand her hormonal changes as she moves through menopause, we leave women feeling very confused and as if she's a visitor in her own body. So, by educating women about the changes she may be experiencing in her 40s and her 50s, we can empower women to take control of her health and teach her how to support herself in these significant health moments in her life. So that's what I kind of wanted to discuss about the PMS experience and then also mood support during perimenopause. There are two pieces of blood work that tend to be run by family doctors, but may not be optimal. So I just pulled two pieces of blood work that I see quite often not being optimal and thereby impacting mood. So, thyroid. 45% of people with depression and 30% of people with anxiety have a thyroid disorder. And also, hypo or underactive thyroid disorders is very common among people who have therapy resistant depression. So, if you've been on multiple types of antidepressant therapy and you're not feeling a resolution in your symptoms, it's imperative to check if you have underactive thyroid, because we can give you all the different antidepressants in the world. If you need thyroid hormone, that's a completely different story, right? The other piece is iron. So, people, including children, so adults and children with iron deficiency, are more likely to have anxiety, depression, insomnia, and also like are more psychotic disorders as well. So, iron in women is especially important, right? If you're pregnant, if you're breastfeeding, if you have a menstrual cycle, or especially if you're in your 40s and your period is newly very heavy, you are more likely to have iron deficiency. And you need to have your iron tested, assessed, and then also treated. So those are two pieces of blood work that need to be optimal, especially in regards to mood. Loneliness. So this is a very interesting part of research, which I'm really starting to love, and that's the impact of loneliness. And I think that's very topical, especially given our climate right now throughout the world, right? So read this and then reread it. Loneliness and weak social connections are associated with a reduction in lifespan similar to that caused by smoking 15 cigarettes a day, and even greater than that associated with obesity, shortening one's lifespan by 8 years. Yeah. The more isolated people are, the less happy they are, and brain function declines as well as physical health. So, as social animals, our constitution demands social contact. Indeed, the need to belong has been described as a primary human motivation. So crucial is social contact that our ability to meet this need carries a significant ramifications for our health and well-being. So, what is loneliness, right? So, it's characterized by the social pain of, here we go, the social pain of perceived social isolation. So, what does that mean? You could be surrounded by people at work. You could go home to a house where you have your spouse and your children. You're consistently surrounded by people, but you can still feel lonely. It's your responsibility to connect with people that are on a similar upward spiral life trajectory, people that you can feel a deep emotional connection to. So, again, you can be surrounded by people and still feel the sensation of loneliness. So that's where my clinic that I work at, Clarity Health in Burlington, we recognize this importance of social connection. So we started a women's health community group. We just started our fall semester last month with a new group of 40 women, and the outcry from women saying that this is a necessary program has been absolutely astonishing. We have some women joining us virtually from Alberta, from New York, from Pittsburgh, and it's a program that we're really, really proud of. Bottom line, whether it's a women's health group like the Wild Collective or some other form of genuine connection, please seek that out. It's absolutely imperative to your health. So, do you notice a change in your mood when you connect with certain groups of people, be it positive or negative? I think we all have some friends who are always seeing things on the more negative side, right? And maybe you notice your mood shift and become more negative when you see them. Maybe when you're with a group of women who are on a similar life trajectory as you, very motivated, very empowered women, maybe you notice how you feel during those interactions. But for sure, noticing how we feel with certain groups of women is important. Mood foods. So this here is a study that was done in 2018 in the World Journal of Psychiatry. And what they did is they came up with an antidepressant food score, the AFS, right? So what they did is they found nutrients that have been shown in human studies to either prevent depression or to treat depression. So they found those nutrients, right? B12, zinc, selenium, etc. And then what they did is they found foods that have really high amounts of those nutrients. So many foods with high AFS scores are actually not commonly consumed in our Western diet. For example, in the US in 2010, so kind of old data, but probably still relevant, only 25% of people consumed more than 3 servings of vegetables a day. That's really upsetting. And then also 10% of the US population consumes the recommended 2 servings of seafood per week. So you can see there's already this gap of missing out on the nutrients that we know improves mental health. So on the left-hand side of your screen, you have animal foods that have really amazing AFS scores. And on the right-hand side, you have vegetable or plant-based foods that have really high AFS scores. And just take a look at those foods and see how often you're consuming these really powerful antioxidant, phytonutrient rich foods. And I'll also say that if you consume foods like this, you're more likely to have a very stable blood sugar. And when we talk to patients about their mood and their anxiety, we're often ensuring that they're eating enough protein, that they're eating enough healthy fiber to maintain a steady blood sugar instead of you have a double double for breakfast with a donut, which makes your blood sugar spike and then crash. And then you feel lousy, you feel anxious, you feel sad, you feel like you're craving more junk food. And then lunch comes around and maybe you eat, a big bowl of pasta without any protein or any vegetables. Your blood sugar goes spike, drop, right? So when we consume lots of fruits and vegetables, our blood sugar stays relatively stable, which is so important for our moods. How many servings of fruits and vegetables do you eat a day on average? Are you like the majority of Americans who fail to eat more than 3 servings of fruits and vegetables per day? Or are you on the side of 7 plus, which is where the research tells us we can actually prevent chronic diseases like cancer, like type 2 diabetes, when we are in the 7 plus servings per day. So this is something that I really resonated with when I saw this, and these are the guideposts for wholehearted living. And I've noticed more and more as I've gone through clinical practice that mindset, the way you view the world, matters so much in your mental health. So I will be sending out the PDF of my presentation so that you will have a copy of this. But even if you take a picture of this and just really read through it and commit it to memory and not just like read and know the words, but really like let those words soak in. And I love the line, there's a few lines I resonate with. Cultivate self-compassion, let go of perfectionism, right? Cultivate gratitude and joy, let go of scarcity. So the research behind gratitude is so powerful. Gratitude is one of our highest frequency emotions. And the research on cultivating gratitude through a gratitude journal or any other sort of practice truly improves people's mental and emotional well-being. So I would love it if we all started um, some sort of gratitude journal, right? And I started this last month, and it's been a great way to start my day. Instead of checking the news, instead of checking my emails, I write down 5 things that I'm very grateful for. So that's been a fun practice over the last month. I just had a quick question about serving of fruits and vegetables. So 1 serving of your leafy vegetables is 1 cup. And then a good way to remember is more like half a cup of either like those kind of more chunky fruits and vegetables. So like your carrots, your cauliflower, your apple, berries, half a cup would be considered a serving. So really, like I drink a smoothie every day. I put 3 cups of spinach and a cup of fruit in there. That's 5 servings of fruits and vegetables in my smoothie. So it's absolutely doable to get there. You just need to put in a little bit of effort and have a little bit of mindfulness around it. Okay, so it's not your fault that you're confused about mental health. This is an aisle at a health food store. So there's so many products, and there's been a good number of clinical trials on supplements that have proven utility in mental health, but you need to be properly assessed in order to know which of these thousands of products are right for you, right? I think we've all walked into health food stores and been just completely like lost and confused, right? So circling back to our girl RB, our 29-year-old menstruating gal with bipolar type 1. So she needed someone to be curious about her health history, specifically her hormonal health history. Upon lining up her symptoms with her menstrual cycle, we determined she more likely had a diagnosis of the severe form of PMS called PMDD. So I referred her back to her family doctor and to her psychiatrist, and she was given a prescription for a specific antidepressant that's been shown to be useful in PMDD. In terms of what we did, we worked on nutrition, so ground flax seeds. We worked on supplements like calcium, magnesium, and then we worked on blood work through iron and vitamin D. And within 2 menstrual cycles, she finally started to feel like herself again. So this gal needed to be properly assessed, and then also no shame in her medication, right? She needed a medication, but she was just on the wrong one, right? So do you want to learn more? So I'm pretty active on Instagram. So if you want to follow along and be curious about, the health tips I give, maybe a couple pictures of my puppy or what I'm eating for dinner, follow along at Dr. Erin ND. And through the link in my bio, you'll be able to be connected to podcasts that I've done, and also the link to our website for if you're ready to become a patient. So I guess maybe thankfully, because of COVID, we've transitioned a lot to virtual visits. So if you're a resident of Ontario, you can either come visit us downtown Burlington, Ontario to see us in person, or you could be in the comfort of your own home in your pajamas, and we can do a virtual visit as well, which is also completely covered by insurance dollars as well, whether it's in person or virtual. And I think that's all from me. I guess we can just check to see questions.
Thank you so much, Erin. That was very informative.
Thank you.
There are a couple open questions and comments in the question and answer box. So Krista says, remind me, how big is a serving of fruit and veggies?
Sure. So fruits and veggies, green leafy veggies. So think like your spinach, think your romaine lettuce, think kale. 1 cup is 1 serving, because there's like lots of air in between those leafies. But then if you are like dealing with more of a dense fruit or vegetable, that's more like 1/2 cup is a serving. So it's completely doable to get there. I think it's just you need to have a bit of like a goal in mind. So my personal goal, this isn't evidence-based at all, but this is what's worked for me, is by the time lunch is over, I need to have 5 servings under my belt.
Oh, wow.
By the time lunch is done, right? So that way I know most likely my dinner will have at least 2.
Mm-hmm.
So that's how I manage that.
Awesome.
Awesome. Am I missing any others?
We have a client that says, from Alex, I'm also a fitness and health coach sponsored by a supplement company, and I have Crohn's. I love this, just a comment.
Awesome.
And Neil says, wow, loved this presentation.
Well, thanks, ladies. Thank you. I was really excited about doing this, mainly because I've seen a lot of mental health stuff come up in women, even if they originally came to see me as a patient and mental health was not a main concern then. But now, just because maybe women aren't going into work as often, or maybe now they're forced to be teachers at home with their kids, and also work full time, and also be a complete stay-at-home mom. Like, it's absolutely unbelievable the pressures that have been put on women. So seek support, right? I think we all thought that this was only going to go on for, I thought it was going to be 2 weeks, but I was very wrong. So this might be something that's going on long term. And so it's your responsibility to reach out and really make sure you're making genuine connections. And you need to have the mental health support that you need.